Good evening. Now it's time to do some pediatric fever case studies. I hope you'll enjoy the case studies as much as the lecture on fever. And without further ado, we'll go ahead and start the case study. I would like for you to use the fever guidelines provided in this week's module to help you work through the case. There are several guidelines based on age, and you want to start first with the youngest category in the 0 to 28 days, I believe. And here's a quick glimpse at the fever guideline. That's 29 to 60 days. And here's the 0 to 28 days. So Caleb is a 26-day-old white male right now, and he comes in with a chief complaint of fever of 38.5 rectal. So what questions do you have for the parents? Medical and social history questions. You'll want to know birth history. Was he full term? Yes. He's 39 weeks full term. His birth weight, 7 pounds, 11 ounces. No complications with his delivery. He was a normal vaginal delivery. He has no history of surgeries, no hospitalizations. And what about, was he circumcised? No, Mom says he was not circumcised. Does he attend daycare? No, he's at home with his family. Is anybody else sick at home? No one else is sick. And no history of any travel abroad. This travel history is very important, especially in metropolitan areas where people are traveling internationally quite often. With the Ebola virus, we had a huge screening initiative for travel abroad, and then with the Zika virus, I imagine it's an important travel question, maybe more important in OBGYN clinics, but nevertheless, don't ever forget about travel history. And does he have any allergies to any medicines, or he's really not eating any foods, but any allergies that the parents have noticed? And no, he does not. How is he feeding? Always important question with the kids, because you know if they're eating, they're not terribly sick, typically. He is taking 3 ounces of his formula about every 3 hours. And next, you'll want to ask questions about the history of present illness. Let's get some more details. Often I'll say to parents, well, let me get some background information before we talk about what's been going on today. Because sometimes once you get into the history of present illness, you kind of forget to go back and get the medical history, surgical history. So when did this start? Was 38.5 the highest reading? Any other symptoms? Usually you will ask an open-ended question about what other symptoms they may have along with the fever before I go into my own rattling off appropriate review of system questions. And the parents report the fever started about 30 hours ago for Caleb. He has no other symptoms, and yes, the 38.5 was the highest reading at home, and they did take it rectally. Review of systems. General, how's his appetite? Activity, we already heard about his appetite being pretty good. Respiratory complaints. Has he had any shortness of breath, difficulty breathing, increased work of breathing, retractions, nasal flaring, all that? Any cough? The answer's negative on all counts. HEENT. What about nasal drainage? Ear drainage? Are his eyes red or draining? He's a little too young at this age to be pulling at his ears. And younger infants don't tend to get ear infections. But next, for GI symptoms, has the child been vomiting, diarrhea, constipation, any distension of the stomach noted? When was his last stool, and what was the consistency and appearance? For GU, any penile discharge, normal wet diapers? Try to quantify the diaper count over the last 24 hours. And lastly, what about the skin? Are any new rashes? Okay, so you go ahead and do your physical exam after a thorough history is taken. And there's no significant findings on the exam besides Caleb is slightly tachycardic. And you do notice he is uncircumcised, as Mom reported. He looks well hydrated. His mucous membranes are moist. He actually has a wet diaper on exam. He cries during the course of the exam, but he is consolable. His vital signs at your clinic are a rectal temperature of 39.0 now, up from the 38.5. The respirations are at 50. Pulse ox looks good at 99% on room air. The pulse, 168. And his current weight is 10 pounds and 3 ounces. So he's gained at least a couple of pounds since birth. So that's pretty good. So what do you want to do next? So the question really is, what kind of workup will you do for Caleb? Look at your fever guideline now for the 0 to 28-day-old infant, and let's decide. Test. First, stop your urinalysis with micro and a urine culture. Based on his age, he needs to have blood work for CBC with diff, blood cultures, and you may consider collecting HSV serum tests, but you can hold that. If you're at an outpatient clinic, you might send that with the child to the emergency room. Lumbar puncture. And also, we still need to get a blood pressure on this child due to his age. Put him on a cardiac monitor if he's available, and put him on a strict NPO status, all based on the fever guideline for 0 to 28 days. Okay, what if the child had a cough with this fever? What else might you order? There's a gray area on your printout for the fever guideline that addresses some of these concerns. And let's see. Yes, and if we're coughing or having any respiratory symptoms, wheezing, we need to go ahead and get a chest x-ray. And you always get the PA and lateral. What if the child has diarrhea? What might you also add to this order set? Yes, you would add a stool culture. Now, let's change things up a bit. If Caleb is now a 29-day-old child that presents with all the same symptoms and past medical history, all the same, what would you leave off? So this is where you pull up the next stair-step fever guideline, which is 29 to 60 days of age. So take a look at that for a second, and what is missing from the workup. That's right, no lumbar puncture is necessary initially at this age range. You still may need to do a lumbar puncture if antibiotics will be given to the patient, or if there's any abnormal test result, including an elevated white count above 15,000 or a low white blood cell count below 5,000, bands greater than 1,500, a CRP greater than 6, that's a little typo there, if that was ordered, and then if nitrates are positive on the dipstick or greater than 10 WBCs on the urine microscopy, you will need to go ahead and proceed with the lumbar puncture, which is an invasive procedure. IV access is actually optional at this age, where in the younger newborn it is advised to go ahead and get the IV access. Okay, so let's go take this child to another level here, where he's now a 65-day-old child. All the same symptoms and past medical history. What would you leave off now? Well, there's no lumbar puncture indicated at all. Is the temp 39 or greater? Yes, it is. So then we still need to do a UA, urine culture, CBC with diff, and a blood culture ×1. Now, on the 2 older kids' fever guidelines, you're going to see this nice little UTI risk calculator. And so I'd like for you to look at that now. It's, again, on the right hand column, about 1/3 of the way down. It has UTI risk factors and then a probability of UTI chart. So let's count up Caleb's risk factors, shall we? He is a white male. He is uncircumcised. His temperature is equal to or greater than 39.0. He's had his fever 30 hours, so he meets the criteria of for a risk if the fever's gone on for longer than 24 hours. And he has an absence of another source of infection. We really don't see much on exam. It looks actually pretty good considering he's got this little fever. Okay, so Caleb has over 5 risk factors for a UTI. So UTI screening is clearly indicated even if he was a much older child, close to the 24 months of age. There's still no other source of fever present, so you should always think of ruling out a UTI when you can't find a source for the fever. In girls, and especially in uncircumcised boys, you should always think of UTI. Okay, Caleb is not a neonate any longer, but a 23-month-old, and his highest temperature, including the clinic reading, is 38.7, along with a new cough and congestion that started about 2 days ago. So if you look at the fever guideline for 6 months through 24 months of age, he does meet the inclusion criteria at the top right-hand column. We forgot to ask earlier, but he does have his immunizations complete. On exam, you find he has clear nasal drainage, his TMs look good, his cough is audible during the exam, but his lungs are clear, good aeration throughout, easy worker breathing, a normal respiratory rate, pulse ox, and blood pressure. His heart rate is slightly tachycardic at 143 beats per minute, but you'd expect an elevation with a fever on the heart rate. Again, we omitted the immunization status, but he's up to date. So now, how does that change things if you look at the algorithm? He is now getting a diagnosis of a pediatric fever secondary to a cold virus. The plan is simple. Tylenol or Motrin for fever discomfort. You don't have to treat the fever just for the fever's sake. Encourage oral fluids and recheck with PCP in 2 days. At the 72-hour mark,